In a surprising interview with Oprah Winfrey, Meghan Markle revealed her struggle with suicidal thoughts. Markle's story is a reminder that stigma surrounding suicide and mental health issues is as present as ever, even for people of high status. Intermountain Healthcare community health specialist Catherine Richards is joining me today to talk about suicide prevention. Catherine, this is an issue that is so pertinent to both genders, to people of all ages, and it really is such a serious problem, not only here in our communities and state, but across the country.
Yeah, absolutely. And we know that Utah had the 5th highest age-adjusted suicide rate in the United States. We know that it's a problem here, for ourselves, for our communities, for the state, and more, like you said. And I think Meghan Markle, telling in a very brave way, in a very open and honest way, telling her own struggle with suicidal ideation and, her struggle with actually going and seeking mental health care is really something that many of us and many people in our community have experienced and can relate to.
Taking that cue from Meghan Markle's, she explained how she did go to the royal family, her assistants asking for that help, and she wasn't provided the help. What do you do if somebody comes to you and says, hey, look, I'm struggling. Can you help me? I need some direction here. What should somebody do?
Yeah, well, unfortunately, when she did go and asked for help and said, this is what I'm struggling with and I really need to get some treatment, she was told that no, that's not possible. We're concerned about how it might look. And, really we should be doing the exact opposite of that. We shouldn't be shying away from the conversation. Anytime somebody is honest with us and is open about their struggles, we should first and foremost listen. We should be non-judgmental. We should be empathetic. And then we should help and work with them to try and get them to the proper resources. And I'll also just mention that, for many of us, we are very uncomfortable talking about suicide, and there's also a widespread misconception that talking about suicide actually can cause it, and that's just not the truth. And we want people to feel comfortable coming forward, and we want them to feel like they will be supported. And so that's the best thing to do, is to support and listen, and then get them connected to resources.
I'm thinking about people right now that may not have others in which they can turn to seek guidance and help. If people are truly feeling alone, that they can't turn to anybody and talk to them, where can they go?
Yeah, that's a really great point, especially right now. We're in such a strange place with the pandemic, and I think that you're right. A lot of people are really struggling with that. And I would urge them, even if you're not feeling like you're having suicidal thoughts in the morning or in the moment, you can certainly still reach out to the National Suicide Prevention Lifeline. You can also use the Safe UT app, which is a really great resource. You can just text and you can get connected to somebody. And then Intermountain has also stood up the Emotional Health Relief Hotline that you can call as well, and they'll help you get connected to the right types of resources. And even if you just need to have a conversation, they're a great resource to call.
Fantastic. Good information. And don't worry about cost. Get the help. Those hotlines are there for you. They're always open and they are free. Please reach out to someone. Catherine Richards, community health specialist with Intermountain Healthcare. Thank you so much. We will put the Lifeline phone number as well as more information on our website at fox13now.com.